Good afternoon and welcome to this community briefing on our ongoing pandemic efforts. I'm Health Director Pat Lopez, and today providing interpretation for us is Margie Prop. Thank you, Margie, and thanks to everyone for joining us to learn about the latest local developments. The Delta variant continues to circulate at high levels in our community, and our situation remains critical. We are seeing a sign of improvement in our case numbers, but the number of COVID-19 hospitalization remains very high. In looking at our local data, the increase in cases has slowed and started to level off. We are seeing a decline in our 7-day rolling average of daily new cases, which really is very encouraging. You can see the increase from 58 at the beginning of August 1st to the high of 137 on August 30th. Toward the end of last week, the average had decreased from 108 on September 9th. It is still too early to tell if the decrease will continue or if we will start to see the downward trend we all want. The community positivity rate has held steady between 10 and 12% for the 3 weeks ending September 11th. As I mentioned, the number of COVID-19 patients hospitalized locally remains high, and hospital capacity continues to be a serious concern. When we look at the 7-day rolling average of COVID-19 patients in local hospitals, it more than doubled from 50 on August 1st to 106 on September 11th. At the end of last week, the increase had slowed and was hovering around 106. But in the last couple of days, we have seen another increase, mostly from patients outside Lancaster County. Today, a total of 119 patients are reported hospitalized, with 20 of them on ventilators. 47 of these patients are from outside of Lancaster County. We have no new deaths to report today. Sadly, 6 people have died from COVID-19 so far in September, and 4 of these individuals were unvaccinated. Nearly 5,500 vaccinations have been administered so far in September. Just over half were second doses. Now more than 72% of our residents aged 16 and up are fully vaccinated. We're getting closer to our goal of 75%. We are encouraged by the improvement of the number of new cases, but we would like to see fewer new cases as well as fewer people needing hospitalization and a lower positivity rate and more people getting vaccinated. For this reason, the risk dial remains in mid-orange this week for the 4th consecutive week. Orange indicates that the risk of the virus spreading and the impact on our community continues to be high. The key metrics of positivity rate and case rate remain in the red category. Hospital capacity and deaths are in the orange. The vaccination rate, contact tracing, and testing turnaround time all remain in the yellow category. The blue square you see outlined in red on the color-coded chart indicates the current position of the dial. Vaccination continues to be our best defense against the Delta variant. The Delta variant hits people harder and faster and is causing more severe illness, particularly in those who are unvaccinated. We strongly urge every person who is eligible to get vaccinated to receive the vaccine. It continues to provide strong protection against severe disease, hospitalization, and death. And even if you've had COVID-19, the recent research shows that vaccination can offer added protection against reinfection. Throughout the pandemic, we've been committed to ensuring every Lancaster County resident has the opportunity to receive vaccine. We've worked with community partners to host neighborhood clinics that help make vaccination more convenient and close to home. We continue to collaborate with our cultural community centers and others to expand vaccination efforts and help ensure vaccines are equitably accessible. Joining us today are Eva Ayala, a health advocate at El Centro de las Americas, and Lee Kramer, Program Manager at the Asian Community and Cultural Center. Both centers are hosting vaccination clinics at their outdoor events this weekend in partnership with the Health Department. Thank you for being here. I'm going to turn the podium over to Eva so she can share more information. Eva?
Thank you, Pat. Good afternoon. El Centro de las Americas is a nonprofit organization, and we work closely with Hispanic and Latino communities in achieving self-sufficiency, civic engagement, and personal growth in the areas of education, social, and health services. And we are working together with the Health Department and having a vaccination clinic during the Latino Festival this Saturday from 3:30 to 6:45 p.m. We are extremely excited and invite everybody to come out and enjoy the Latino Festival from 2 to 8 p.m. at Antelope Park. Come and discover Latin culture in the eyes of art, music, and food. And as a parent, I highly encourage everybody to go out and receive the vaccine and protect those that are most vulnerable in our community. And we will be following our local health measures during the event. Thank you.
Thank you, Eva. And now joining us via Zoom with some additional information is Lee Kramer from the Asian Community and Cultural Center. Welcome, Lee.
Hi, everyone. Thank you for having me. My name is Lee Kramer. I'm the programs manager at the Asian Center, and we are excited to continue to be involved in several of these activities around the community to promote vaccination. So the Asian Community and Cultural Center serves all immigrants and refugees in Lincoln, including folks that have been here just a couple days to 20 years or more. So we serve many different individuals from all backgrounds, and we continue to work hard to provide opportunities for folks to be vaccinated and to get more information that is from a trusted source and also translated to many different languages. So this weekend, we're excited to be able to partner with the Health Department during our Harvest Moon Festival this Sunday, September 19th, from 4 to 7 p.m. And we will not only be offering, of course, additional information about COVID-19 vaccination, but we'll also be helping to connect our community members to vaccinations at the event. And we'll also have some incentives available as well for folks who have already gotten vaccinated and who will choose to get vaccinated that day. So we look forward to hopefully signing a few of you up this weekend. And we will be having masks required at our event because we hope to have quite a few folks coming, and it will be outside at Antelope Park. So we hope to see you there.
Thank you, Lee, and thank you, Eva. We really appreciate the assistance you both provided in organizing the clinics. And every person vaccinated helps create needed protection for our community. Walk-ins are welcome at both of these clinics at these events, or people can schedule an appointment at covid19.lincoln.ne.gov or by calling us at 402-441-8006. We also continue to work with schools, colleges, and universities and have several clinics scheduled on site throughout September and into October. Vaccine is really readily available every day in our community. You can find upcoming vaccination clinics at the covid19.lincoln.ne.gov site or by calling us again at 402-441-8006. You can also find local pharmacies offering vaccinations at vaccines.gov or by texting your zip code to 438829. We also continue to administer third doses of vaccine to those individuals who have weakened immune systems. Those third doses are different than booster doses. Booster doses are not yet available, and they still need to be authorized by the Food and Drug Administration and recommended by a CDC advisory committee. If approved, you all will receive more information on who will be eligible for booster doses and when. We're in the process of writing plans and securing locations for booster dose clinics, and we'll be ready to put our plans into action as soon as those booster doses are available. As I've said before, vaccination remains the main tool to reduce cases, hospitalizations, and deaths. But masks are also a proven strategy to reduce the risk of spread in our community. To get us through this Delta-driven surge and bring our numbers down, we need a collective effort by all our residents. We do want to remind everyone that our current directed health measure remains in effect through September 30th, and that masks must be worn indoors. Our actions have been and will continue to be guided by the latest data, and residents can track our local data dial via the COVID-19 dashboard. We also issue COVID-19 updates every weekday that include the latest data and information. These are all posted at the covid19.lincoln.ne.gov website and on the city's homepage at lincoln.ne.gov. If you use social media, you can also follow us on the City of Lincoln and Lincoln-Lancaster County Health Department on Twitter, Facebook for COVID-19 information and updates. And if you have COVID-19 questions or if you're seeking general information and resources, the hotline is operated Monday through Friday from 8 to 4:30 at 402-441-8006. And with that, we'd be happy to take any questions.
Touching on that mask mandate, about 2 weeks or so out from when it gets, where would you like those 7 key indicators to be for that to go away? And at this point, would it be possible that you would re-up it again when that date hits?
Well, we want to see our positivity rate become more stable and drop definitely under 10, and our case numbers to decrease. Even though we're starting to see an increase, we're still at a really high number, and so we definitely need to see that decrease. And we're still monitoring the hospitalizations. So, I think this next week for us is really going to be critical in looking at our data to kind of determine where our 3-week average is and make decisions about what we need to do after September 30th.
Are there certain numbers in that category that you would like to hit, or are you looking at it maybe as a bigger picture?
We're looking at a bigger picture, but we definitely need to see our positivity rate go down and our case numbers go down.
And then sort of touching off of that, if the mask mandate were to go away, would it stay in places like universities and maybe LPS, or is that conversations that you would have with those entities at that time, or are you already having those?
No, we already recommended that our K through 12 schools require masking for those, K through 6. But we haven't had any specific discussions about specified areas that would be at this point. We're looking at our whole community effort going forward.
Hi, Pat. It's Matt Olberding from the Girl Star.
Hi, Matt.
Hi. Hey, I wanted to ask you, so it was a pretty significant drop last week in cases. I think it was about 25%. How much of that do you think is, it was a holiday week last week. We had Labor Day. So, there may have been people who didn't go get tested because it was a holiday. But do you attribute most of that drop or a big part of it to people doing things right, like wearing masks, staying out of crowded situations? Do you feel like there's kind of positive energy, or do you feel more like that was a 1 week kind of holiday week blip?
I think it is that we're seeing the impact of wearing the mask, but we have to see it sustained for a little bit longer period of time. And actually, it was just a little bit over a 24% drop that we saw last week, which is really encouraging. But it'll take a little bit for that to catch up with what's happening with hospitalizations. That's why the next week or so is going to be critical for us to really see. We are encouraged by what's happening, and I do think the majority of people in our community are really following the recommendations and trying to protect themselves and their loved ones. And as we've seen before, when we had a mask mandate, it really made a difference.
Pat, we have a question from KLKN. They ask, locally, statewide, and nationally, COVID cases have been lower than weeks prior. Have we reached our peak, or are we expecting things to change?
No, I don't know that we can say statewide because I'm on calls with our health directors across the state frequently, almost every day, and there's really very little testing available outside of the Omaha and Lincoln area. So I don't know that we can say our numbers are dropping across the state. We're hearing about people needing hospitalizations for COVID, and there are not beds available still, even though there's a transfer center. So in Nebraska, with the absence of data that we're seeing statewide, it's hard to say, but I'm not sure that we've really hit that peak, and I see that in other areas that is happening. But I keep hearing from more and more cases, a little bit of decrease in Omaha and Sarpy County, but I'm not sure that represent, as well as us, really is representative of our state. And remember, some of those other states that we're looking at nationally have peaked sooner than we did. They started going up sooner than we did. So we've usually been a little behind. We're very cautiously optimistic, though.
Past couple, you mentioned a bulk of the hospitalizations are people coming out from outside Lancaster County. How much of a factor is that playing in maybe those case numbers of people traveling to Lincoln from outside who maybe aren't vaccinated or carrying that Delta variant into Lancaster County?
I think that, we see people coming into Lancaster County, but that's occurred all along during this whole time. But what we're seeing is that more of these cases, now that our case numbers requiring hospitalization are decreasing, our hospitals are able to accept those community members from outside Lancaster County. And if you remember, when we first started for many months, most of our cases came from outside, that were hospitalized were outside Lancaster County. Okay. Thank you for joining us today. And I hope you get vaccinated if you need to be vaccinated, if you haven't had that opportunity yet. And please wear your mask and be well. Thank you.